Hey guys, welcome back to my channel. My name is Addie for those that are new here. Today I'm going to share with you some differences between midwives and OBGYNs because I have had a few questions on that topic and requests for this video since the last couple videos that I have posted. I have had one birth in a hospital with a traditional OBGYN. I have had one birth at home with parallel care between a midwife and an OBGYN. And for this baby, this third one, I am 34 weeks pregnant. I am having another home birth and doing it solely with a midwife this time around. So I have kind of run the gambit of options. And so I thought I would just walk you through, what they are and some of the differences. So first off, everybody kind of knows what a traditional OBGYN is, I think. So I'm not going to focus on that too much, but basically an OB is a medical doctor who has gone to school, gotten a degree, has done a 4-year residency in obstetrics and gynecology, and is basically there to help with pregnancy and female reproductive health. There is another layer to that, which is a board certified OBGYN, and they have passed additional rigorous testing, both written and oral. So that is another, layer or a higher tier, I guess, to OB care. But those would be the two options for traditional OBGYNs. Then you have midwives. And there's kind of 3 layers of midwives. One is a CPM, and that is a certified professional midwife. That is a licensed midwife. And for them, they go to school, they, are trained. They can pretty much do anything that your OB can, except for C-section. They cannot do surgery. So that is a big, difference between the two. Most licensed midwives, I would say, probably do home births, but they can do, they can order lab work, they can do ultrasounds, they can do testing, they can help you with medications, that sort of thing. So they are pretty much like your OB, except for they can't do surgery. Then there is certified nurse midwives, CNMs, and they are fully trained nurses. They have gone to school to become a nurse, but then in addition, they have their midwifery certification as well. They mostly practice in hospitals or in birthing centers. And then the third tier is a lay midwife or just, a regular midwife. And that can mean a couple different things depending on where they are. So it could be that they have gotten their knowledge and experience through apprenticeship. They have just learned through generations or through someone else, and they've learned it and become a midwife themselves, and they just practice. Another reason that they might just be a lay midwife, though, is because the state that they reside in does not offer licensing. So for example, my midwife with my last birth, she was based out of Kentucky, and Kentucky did not offer midwives licensing. So she had gone to school for midwife care, she had done everything, she's trained in everything, but she could not call herself a licensed certified professional midwife because Kentucky did not license midwives. Now this time around, in the past, time since I'd given birth, Kentucky has changed their laws and now they can. She is now a certified licensed professional midwife and can do ultrasounds and order lab work and order an epidural if she wanted, those sorts of things. So it just depends on the state. So I'm not saying that just because you're a lay midwife means that you're not trained by classic education methods, because they very well could be. But if the state, there's only 31 states in the US that offer licensing. So if she's in one of the states that doesn't offer licensing, she'd be considered a lay midwife and kind of couldn't do some of those other things. And if you would want ultrasounds, for example, you would have to have parallel care and work with a traditional OB to, get some of those things that she can't provide as a lay midwife. So those are kind of the 3 different tiers, and that is why I had parallel care with my second birth, was because she wasn't licensed. So I had dual care. But anyway, so those are the different types. And then now I'll just tell you some of the differences that I've experienced having, the different types. I have actually had 2 OBGYNs. I had one for my oldest and then a different one for my second. And then I've only had one midwife my current one. So I will preface this by saying that both OBGYNs and midwives are both highly trained medical professionals that both ultimately just want your health and safety and, you know, safe delivery of you and your baby. So I will just preface that. They both want the same goal in the end. I think having been through it, the biggest differences that I have experienced between the two is one, the personalized care, two is the time spent with the patient, me, or the mother, and three probably would be just the difference in maybe location, options of giving birth, or pain management. So first I will talk about personal care. Having an OB, I actually liked my experience. Well, I liked my second OB better than my first OB, but whatever. But I did not mind my experience with my OB care at all. Like, I thought it was pretty good, nothing wrong with it, until I had an appointment with my midwife, and I was like, what is going on? Like, I had no clue the level of personalized care, the way that they get to know your personal situation and your personal pregnancy. I've never experienced that with another doctor of any kind. So that was definitely very, very eye-opening to me, the difference in that care. And the other thing that kind of goes with that is the time that they spend with you. So at my traditional OB office, it was like, you know, you scheduled your appointment, you went in, you got your weight and blood pressure and all that taken by the nurse. The nurse asked you a few questions, and then when the doctor had a free 10 minutes, she or he came in, they, you know, did what they did. They measured your fundal height, and they asked if you had any questions, and, you know, basically in and out, like 10 minutes tops for the appointment. With a midwife, your appointment is an hour long, like every single time, no matter what. They are asking you questions, you are asking them questions, they just want to know how you are. Like, they almost become part of your family in a way, intimately, in a way that like other people can't. It's very hard to explain. I would say they know how to probe you for questions that you didn't even know you had, or look for situations that could come up that you didn't even know to look for, that the other doctors, like traditional OBs, wouldn't have never asked me into pregnancies. For example, having a headache, you know, that could be something that I think is totally normal for me, that I would never bring up as something that's wrong in a traditional OB appointment, but it's something that my midwife asks. And if I say yes, actually, then we're going into, okay, why could that be happening? And we're trying to find the root cause. And is this normal, or is this something pregnancy related? Is this something we need to monitor? Is this something we need to work on? Things like that. So it's very, midwife care I found is very like proactive rather than reactive. Whereas that's how I kind of felt like OB care was, very reactive. My second pregnancy with this one here, my pregnancy with her was not too bad. Like, I didn't have any, you know, crazy pregnancy issues or whatsoever. So I didn't really, I guess, have too much to complain about to anyone. But this pregnancy has been kind of crazy if you have followed this journey at all. And there are things that my midwife has asked me that have like totally started us on this course to prevent something that probably would have come about had we not done something. So for example, cholestasis is something very early on in pregnancy that I had no clue was going to be an issue for me. I had no idea that I was experiencing problems with my liver. But through her questions that she was asking, she was like, you know, something sounds a little off with symptoms you're describing. I think we need to look more at this. And you know, we watched it and things came up, and she had, you know, some different alternatives and supplements to put me on to try to get things working. And it has completely like made this pregnancy normal again. So obviously this pregnancy has been weird, and there's been other things that have, you know, popped up that we've had to work on, but it's just like those level of questions and the level of time and the level of care based on you specifically, like specialized care versus standardized care that you get with a general OBGYN. So in that respect, then I guess I could say that I think midwives, comparatively to OBs, kind of educate the patient more and, you know, kind of explain why you're doing certain tests or what something could be if you start experiencing this, or what things to look out for if you start experiencing this. Like, they just do a little bit more education, I guess, and let you know kind of more what's happening to your body versus like what you get at a traditional doctor's appointment. And then through that, it's like you get a choice. So the standard of care, for example, going through a traditional doctor is, you know, you have your dating scan, you have your anatomy scan, and then if you're like looking big or you want it, you can maybe get your third growth scan. So that's an ultrasound example. With a midwife, it's like you have the option. Do you want to have an ultrasound or do you not? And if you don't, that's okay. For another example would be the gestational diabetes test. So, you know, you have that no matter what, you're getting it at a traditional doctor, probably between 28 and 32 weeks, and you're most likely going to get the drink. If you don't do it, you're going to be dropped from the practice. There are some who will give you an alternative. I did have one OB that let me do an alternative because I asked for one. So we came up with something that worked, but in general, you're gonna be taking the drink and they're not gonna tell you that there are other options out there. They're just gonna tell you that's what you're doing, unless you kind of know to ask for other options. Whereas with my midwife, it was like, okay, we have the gestational diabetes test. Do you want it? If so, here are all the different testing options I can offer. Which one would you like? So it's like just so much more about choice and how you want your pregnancy to go and giving you options. Those are just two examples, but there are so many. And I just really like the options and the alternatives that you can choose for your pregnancy. Another difference I would say is the control you have over your birth plan. So one, you can choose obviously the location. With a midwife, you can choose your house, you can choose a birthing center, you can choose the hospital. You know, a midwife can kind of deliver at any of those places. Whereas if you go with an OB, you are kind of stuck at a hospital. And being at a hospital versus being at home or in a birthing center changes the way in which you might be able to birth. So for example, you know, having an IV, or having continuous fetal monitoring, or being able to eat at a certain point. Those things are different, so having a midwife gives you more options and freedom to choose what you want your delivery plan or a birth plan to look like. And then in addition, with a midwife, you're building this relationship. They know what you want, you know what they know what you want, and you know what you want, and they're gonna be the ones at your birth for sure. Whereas with a OBGYN, if they're not on call that night, they might not be the ones attending your birth. So for example, for my first, I had a doctor and he was not on call that night. So I had a rotating doctor, but the rotating doctor didn't even get to the hospital on time. So a resident delivered my firstborn. So no one in the room, none of the nurses, none of the doctors had any idea what my birth plan was. I had gone over it with my original doctor, but he wasn't there. So if you don't have, you know, that relationship with that person, you don't know who's gonna get there, your birth plan might not go according to plan because the people in the room with you might not actually have any idea what you're wanting. So that is another factor to consider. Another difference, I think, is probably due dates. There are very few OBs who are comfortable letting you go until baby is ready to come. So very few will let you go to say 42 weeks, whereas midwives are very less worried about, you know, when baby is arriving. There are a lot of standard practices to where, you know, if you go past 40 weeks at all, you're just scheduled for induction. And you know, that's just the way it is. It's just the standard of care. So due date and letting baby come and not needing that intervention is definitely a difference between the two. And then just interventions in general are much lower with midwives than they are with OBs. You know, when you're in a hospital, the likelihood of getting Pitocin is very high. Even if you don't get it during birth, you most likely are going to get it after birth to deliver the placenta. The C-section rate is super high in hospitals and with OBs. In my state alone, it's 31%. So it's very, very high, and interventions are very much more likely with an OBGYN versus with a midwife. Another difference is that midwives are there and can actually provide some breastfeeding support. So that has been something that was amazing with my second, that I'm really looking forward to with my third, because at the hospital and with doctors, they don't do that at all. So you're in your room and you're waiting for the lactation consultant to come, and who knows when they might come. It could be the next day, and you have a whole night to try to figure it out. Whereas your midwife immediately can kind of help you provide some of that support. And then in addition, postpartum, doctors are there for you, the baby on delivery, and then they can provide postpartum care to you for, the 6-week appointment or whatever it is. But midwives, they can also provide care to baby. You don't have to have a pediatrician right away. So they actually can provide baby care and postpartum care for you for 6 weeks after baby is born. So all that newborn testing and stuff the midwife can do, and they don't have to do it immediately right after baby is born. They can give you time to bond and come back, the next day or 48 hours and do some of that testing. So that is awesome, in my opinion, and definitely a benefit of having a midwife over an OB. You can kind of tell from this video, I have much preferred my midwife care versus my OBGYN care. And honestly, I did not know my care was not as good as it could have been with an OB, like I said earlier, until I had a midwife. So I'm not saying that OBs are horrible and they're bad, because they definitely have a place in, birthing. And if that's the way you choose to go, that's totally fine. No judgment here. I'm just trying to give you some differences. And definitely, obviously, if mom has a risk of a heart disease or something, she's definitely going to need to be with an OB. If baby needs surgery has some sort of defect, is going to need surgery after being born, then you're definitely going to want to be with an OB. There are definitely instances where you need OB care. They definitely are totally needed, and I'm not trying to bash them at all. But there are some things having a breech baby, or being over 35, or having gestational diabetes. Those are things that put you in the high risk category for a traditional OBGYN, which are not necessarily high risk to a midwife. They can totally do that. You can totally still birth with a midwife if you have those things. And if there's a situation where a midwife cannot handle care, then she will transfer you to an OBGYN. So for example, if I was to develop, severe preeclampsia or have a placental abruption or something like that, then I'm obviously going to go straight to the hospital and, handle things with an OBGYN. Or if something happens in labor with my midwife at home and she thinks, actually this is not safe anymore, we need to go to the hospital, then she would transfer me. And so there is obviously they are trained, they know how to do things and know when they need to, get things somewhere else. So that definitely is a comfort for me, I guess, in having a home birth, because I know that if something is going wrong, my midwife will get me where I need to go. But actually, statistically, having a birth at home is just as safe as having a hospital birth. So statistically, that is how the numbers go. So I don't want to get into hospital versus home. That could be a whole video in itself. And if you want that, let me know in the comments below. I'm happy to make it. I have a ton of differences since I have done both. But yeah, anyway, those are the differences. Those are the main differences that I wrote down and wanted to share. So that's kind of where I'll end this video today. If you have any more questions, let me know. I'll try to answer them. If this has stemmed other questions, you want a new video on something else, let me know. Happy to film them, and I will see you guys in the next video. Bye.